Hello, this is Dr. Eric Bricker, and thank you for watching A Healthcare Z. Today's topic is stock market influence on healthcare. So, as always, if you could help me out by going on to the comments on either LinkedIn or YouTube and let me know if you can see and hear me okay, just to confirm, that would be super helpful. Let me also remind you that as we're going through the presentation, please leave your comments and your questions in the comment section, again, on LinkedIn and YouTube, and I will answer them throughout the presentation. I'll try to answer them at the end. If I don't get to them, then I will answer them in writing afterwards. And so with that, let me give you a very brief background about myself. Holy moly. There we go. I'm not sure what's going on here. There we go. Thank you for bearing with me. So, again, I'm Dr. Eric Bricker. I originally was a hospital finance consultant before going to medical school. Then went to the University of Illinois for medical school. Then did a internal medicine residency at Johns Hopkins in Baltimore. I'm an internist. Worked as a hospitalist physician at a Baylor hospital in Plano, Texas. I actually started a healthcare navigation firm called Compass Professional Health Services that grew to over 2,000 employer clients and over 1.8 million people that we helped navigate the U.S. healthcare system for over 11 years. And then we sold that business to Alight Solutions. And I continued to want to educate everybody that works in healthcare, especially employers and their broker benefit consultant, about how healthcare really works, because there obviously are things that we can do to improve it. And many of you are subscribed to my A Healthcare Z email newsletter, and you watch my YouTube videos, and you're subscribed to my YouTube channel. So thank you so much for that. And I'm also now the medical director for an alternative health plan called Simple Pay Health. So looks like everybody can see and hear me okay. Now, let's talk about the stock market. So if we work in healthcare, then we have to understand the stock market. It's just part of what we need to do as healthcare finance professionals. And a major reason why we need to understand the stock market is because so much of healthcare company CEO compensation and executive compensation is not in the form of salary, but rather it's in the form of stock. And so the stock drives the income for the people that are running the company. So you can see here on this slide, it says that 87% of health insurance executive pay is in stock and stock options. And this holds true for publicly traded hospital companies, for publicly traded pharmaceutical companies, for publicly traded medical device companies. Like, it's not exactly the same, but the vast majority of the CEO and the executive compensation is in the form of the stock. So on this graphic here, it actually has the names. It's hard to see because it's small. It has the names of the health insurance CEOs, and then it has the percentage of their income, or it has a bar graph that is their pay broken down by category. And you can see this light blue bar here, that's all stock. And then over here on this side, that's all stock options. And then their actual salary, that's just the little black bar. So you can see the vast majority of their pay is in the form of stock. So the performance of the stock and the stock price is like the main source of income for these people. So the stock price drives so much of their behavior. So we talk about incentives, okay? So for these health insurance and hospital and pharma executives, the stock price is the incentive. So we got to talk about stock prices. Okay, so some of these terms you may be very familiar with, others not so much. That's totally fine. We're going to kind of run the gamut here. So the stock price is heavily influenced by what is referred to as the price to earnings ratio, so otherwise known as the PE ratio. So there, and I'll use a specific example here. So here, the price for United, and obviously it fluctuates daily. The approximate price for United now, stock price, is $471 per share. And then you take, and then you divide that by the earnings per share, and we'll talk about earnings per share in a minute. And then that gets you the price to earnings ratio, or 21 in this case for United. So Another way to think about the price to earnings ratio is, what are investors willing to pay for the company's earnings? In other words, the investors look at the earnings per share and they're saying, okay, what type of multiple are we willing to pay on those earnings? So in this case, the investors are willing to pay 21 times United's annual earnings. Now, you have to benchmark that and understand that sort of the over time, the average price to earnings ratio for the S&P is about 15 to 16. So in other words, investors are willing to pay above average for the earnings of United. And we'll talk about why investors are willing to pay more for United's earnings vis-a-vis the earnings of another company. Now, next up, then we have the earnings per share. Okay, so if the price to earnings ratio has the earnings per share as the denominator, then what are earnings per share? So earnings per share in the case of United are $22.19. And this is annual earnings. So you take all of the annual earnings. In this case for United, it's $20,700,000,000. And then you divide it by the number of shares that are out there, otherwise known as the shares outstanding. So you can see here, this huge number here, this 934,949,073 is the number of United shares outstanding. So if a company a company's goal, a CEO's goal in raising their stock price is to raise the earnings. And there's earnings per share. And there's two ways to raise the earnings per share. You can either increase the earnings or you can decrease the shares. And this is where stock buybacks come in. The whole reason that publicly traded companies do stock buybacks, where they take their profit and they use it to buy their own stock and to essentially take it off the stock market, is it allows them to increase their earnings per share by, not by increasing the earnings, but just by decreasing the number of shares. Okay, now, how does a company increase earnings? The number one way for a company to increase earnings is to increase sales. And by the way, earnings it means profit. Okay, there's a gazillion different ways to measure. Some talk about free cash flow and blah, blah, blah. So just know that the earnings is essentially their profit, right? So the best way for a company to raise their profit or their earnings is to raise their sales. So United's sales in 2022 were $324 billion. Or another word for sales is, they'll refer to it as revenue. Okay, so, and that was up 13% year over year versus 2021. So if you're the CEO, what you're trying to do is you're trying to, now you can also cut costs, but there's only so much cost cutting you can do, right? So cost cutting will increase your earnings somewhat, but really the main thrust of growing earnings is by growing sales. So what the CEO can do, there's only certain levers that the CEO can pull, right? They can increase sales. They can decrease their shares outstanding with stock buybacks. They can use those to increase their earnings per share. And then the multiple, in other words, the P/E ratio that investors place on those earnings per share is really based upon how quickly sales and earnings are accelerating. So if a company is able to grow their sales and their earnings very rapidly, then those companies tend to get much higher PE ratios. Whereas if the company is not growing very fast, then they're going to have a lower PE ratio. So so much in the stock market is based upon what's referred to as rate of change. So it's not the absolute value of something, it is how quickly it is changing, whether it's going up, whether it's going down, and how quickly it's going up and how quickly it's going down. Okay, so now I apologize in advance. We're going to have to go through a lot of numbers, but this is important because if we work in healthcare finance, the numbers essentially tell a story. Okay, so let's compare the largest publicly traded health insurance companies. So United, their stock price is $471 per share. And this is in early March of 2023 that we're doing this. And their earnings per share are $22.19, like we said, and they have a PE ratio of 21, just like we said. Now let's compare that to the other large health insurance companies. So CVS Health has a stock price of $79, and their earnings per share is much less. It's $8.69, and their PE ratio is 9. Look at that. Investors value United United's earnings more than 2 times more than CVS. The fact that United's P ratio is 21 and CVS's is 9, that means that investors like United's earnings much more than they like CVS's earnings. Okay. Next up, we have Elevance, which is the newer name for Anthem. Okay. So now I'm gonna expand this a little bit so you can see it better. Okay, so their stock price is $468. Their earnings per share is 29.07, and their earnings and their PE ratio is 16. Okay, so investors like Elevance's earnings more than CVS, but not as much as United's. And then finally, we have down here at the bottom is Cigna. And Cigna is $277 a share. It's $23.27 is their earnings per share. So you can see that the earnings per share here for each one of these three is actually pretty similar. And then the PE ratio for Cigna is less than Elevance and a little bit more than CVS. So in terms of like, if you were to rank how much investors like each of these companies and their future prospects for future earnings and how rapidly they can grow their future earnings, they like United the most. They like Elevance the second most. They like Cigna the third most, and they like CVS the last. All right, next up, let's move over to hospitals. So health insurance companies are not the only publicly traded healthcare companies. There are publicly traded hospitals as well. And the largest publicly traded hospital in America is HCA, Hospital Corporation of America, based in Nashville, Tennessee. Now, their stock price is $256 per share. Their earnings per share is $16.89. Their PE ratio is 15. Okay, so that's actually fairly comparable to Anthem and Cigna in terms of how investors value HCA's earnings. But it's not as good as United's, right? So United's is still, you can almost think like, remember, a company is kind of like a house, right? And sort of the classic saying of a realtor is your house is worth only what somebody else is willing to pay for it. And so same thing at a company. A company is only worth what people are willing to pay for the stock. And so you can see that on an attractiveness basis, that HCA is more attractive than CVS, but less attractive than United. Okay, then there's Universal Health Services, which a lot of people haven't heard of this company, but it's a huge, they don't do like the main hospitals per se, but they do a lot of like SNFs and LTACs and all that sort of other sort of quote unquote healthcare facilities. $123 per share, $9.88 earnings per share, and their PE ratio is 12. Okay, so again, not as high as United, but not as low as CVS. And then you have Tenet, that is, and again, let me just kind of make this bigger so you can see it, which is another hospital company. They're actually moving in the direction of being much more of an ambulatory surgery center, an ASC company. $58 per share is their share price, $6.08 is their earnings per share, and they're only valued at 9. So they're only sort of seen as quote unquote popular as CVS. Okay, next, let's move to drug companies. Okay, so now Novo Nordisk, which is actually based in Denmark, but they are huge makers of insulin. And then they're also huge makers of this new medication you probably heard of called Ozempic that's used for diabetics, but it can also be used for weight loss. So this becomes like hugely popular. Like Weight Watcher just bought this like telemedicine startup that prescribes gobs of Ozempic to like help people lose weight, not through like the Weight Watchers diet plan, but through like taking Ozempic. And so it's like, holy moly, like if you have a drug that can actually cause people to lose weight, like that's gonna be a blockbuster. So their stock price, $143 per share, their earnings per share, $3.52. So like much lower than the earnings per share of the hospitals and the health insurance. Look at the PE ratio. Holy freaking moly. Investors are like, wow, we really value the earnings of Novo Nordisk. Why? Because they think that the earnings of Novo Nordisk are going to accelerate much faster than that of United or HCA. Next up, Eli Lilly. Again, big maker of insulin and also a maker of a medication very similar to Ozempic that helps people lose weight with diabetes. Trulicity, $317 per share. Earnings per share, $7.94. Look at their PD ratio, 39. Like, holy moly, blows the hospitals and the health insurance companies out of the water. All right. I mean, look at that. So when we think about, so keep in mind, what do Novo Nordisk and Eli Lilly, what do they specialize in? They specialize in treatments for the obese, both in terms of their insulin and in terms of their Ozempic and their Trulicity. And these medications are in a class referred to as GLP-1 inhibitors. So you might hear that term thrown around. Listen, if you work in healthcare, you need to understand you need to know the names Ozempic and Trulicity, and you need to know what a GLP-1 is. Okay, this is just, I mean, you got to keep up with the times. You just have to know what these things are. Okay, next up, we have AbbVie. Oh, excuse me, Merck, $109 per share, $7.48 earnings per share. Look at that. P multiple, not even close, right? So this is in the middle. This is like Anthem and Cigna, not even close to Novo Nordisk. So not all pharmaceutical companies have high PE ratios, okay? It's just only if they have a blockbuster drug. Okay, which takes us to AbbVie. Okay, remember, AbbVie is the maker of Humira, which is the largest selling drug in the history of the world. But it has just come off patent, and now biosimilars are being made. So its stock price, $149 per share. Its earnings per share is $13.77. Look at that. The PE ratio is less than Merck, and it's way lower. Why? Because Humira isn't on patent anymore, because that candle is kind of burnt out. So investors are not hugely bullish on the future of AbbVie from a PE ratio perspective, whereas the value or the popularity of the earnings of Novo Nordisk and Eli Lilly is much higher. Okay, Pfizer, okay? Historically, the largest pharmaceutical company in America, not anymore. Makers of the COVID vaccine. You would think, oh, huge. Like, look at this. Stock price, $40 per share. Earnings per share, $6.58. Look, still like almost twice as much as Novo Nordisk. Look at that PE ratio for Pfizer, 6. Okay, so just because you're a pharmaceutical company, that doesn't mean you're popular. It doesn't mean your stock is popular. It doesn't mean your prospects for earnings are great, because investors in this case are like, we think that Novo Nordisk and Eli Lilly are essentially like almost 7 times more valuable than Pfizer. Okay, so now with that, let me pause here for a second and see what questions or comments you guys have. So thank you so much for putting this in. So Chris here asked a question, is this just related to CEO pay, or is there deep stock-based compensation for all C-suite VPs? Great question. The short answer is yes. So the compensation is majority stock for the people in the C-suite, and then it even goes down the ladder further to other vice presidents as well. Now, the degree of the stock-based compensation obviously decreases the further down the executive hierarchy that you are, but it is also part of it as well. Thank you for your question. So Elizabeth is asking the question, is that net profit or gross profit, total revenue versus profit? So just understand that all of this, unfortunately, it's a complicated answer, right? So the earnings per share, they'll refer to something as EBITDA, okay, earnings before interest, taxation, and amortization, okay? So, but some analysts are like, well, I don't really think that EBITDA is earnings. Is actually like, because you can do a whole bunch of accounting hocus pocus that's completely legal, right? And that but really, some investors are like, look, free cash flow, like actually how much cash is coming into the bank, is in the bank, and is like how much cash they've actually booked in the bank is actually a better sort of metric for the actual profit of the organization. So some analysts actually kind of look at the free cash flow. But in terms of what's reported, it's reported not in free cash flow per share. It's reported in earnings per share. So anyway, that's a whole nother conversation for another day, but thank you for that question. Okay. Another question for Novo Nordisk is the recent caps on out-of-pocket costs for insulin. So Eli Lilly recently announced that they were going to cap the out-of-pocket cost on insulin. Now, will it affect the stock? Now, I would argue that that is more for PR than actual financial implications for Eli. Because remember, the CEO is concerned about the stock price. Okay. The CEO of Eli Lilly or Novo Nordisk would never do something to decrease the stock price. So the question we need to ask ourselves is, does putting that cap on insulin, does it decrease the stock price? I guarantee you the CEO and all the executives at Novo Nordisk and Eli Lilly are saying no. Because if the cap on insulin would decrease the stock price, they would never do it. They would not. Okay. Do you have any information about Novo Nordisk and their relationship with Weight Watchers? I do not. I just want to add that Novo Nordisk basically is Denmark. Okay. It's a Danish company. Like Denmark is like Novo Nordisk and Lego. Okay. So just keep that in mind. Small country. So that's it. Sorry about my phone interruption there. All right. So now we've got the market capitalization, super important to understand. Okay. So market capitalization is the price per share times the number of shares. It is essentially the total value of the company. It's like the price of the house, right? A share is you're just buying a piece of the house. What if you put all those pieces of the house together? What's the total price of the house? Okay. The market capitalization of healthcare companies is hugely different. United's market capitalization is the largest. It is $440 billion. I left off the B there by accident. Look at this. CVS, $101 billion. Elevance, $110 billion. They are they're a quarter of the size of United. So when we talk about quote unquote health insurance companies, just know that they're not even close to each other. Okay. And you've heard me say this before. United is incredibly larger than CVS. Okay. So with that, let me pause here for a second because I'm getting calls from my wife. So just hold on a second. Okay. Thank you for bearing with me. Okay. So, next up, HCA. Look at how small HCA's market capitalization is compared to United. So HCA, you're like 71 billion. That's huge. I mean, HCA is a little itsy bitsy teeny weeny company compared to United. UHS, look at that, 9 billion, nothing. Look at that. Of the hospital, like UHS is nothing compared to HCA. Tenet is nothing compared to HCA. Like these are totally different companies. I mean, this is like some like mega mansion, and this is a little World War II like salt box house. Okay. Look at Novo Nordisk, almost the same size as United. Look at that. Unbelievable. Triple the size of CVS and Elevance. Eli Lilly, again, triple the size of CVS and Elevance. Merck, AbbVie, Pfizer, okay? These are huge, huge companies. So this is like the mega crazy huge mansion. These are like the McMansions, okay? I mean, this is unbelievable. Now, I think it's important to actually look at the stock charts, right? So that when we look at stocks, you're always seeing charts. So let's look at some charts. So I picked 2010 as the starting year over here on the left, because that was the year that the ACA was passed up to current day. And this is a log. Whenever you're looking at stock charts, you need to look at a logarithmic graph. So this is a logarithmic graph. So that way you can judge to see on the percentage basis how quickly the stock is increasing, right? Because if a stock goes from 20 to 22, that is a 10% increase in the stock. Now, let's say over time that stock goes to 100. Well, if that stock goes from 100 to 120, again, that's a 20% increase in the stock. And again, rate of change is what we care about. The percentage change is what we care about. But in order to get a 20% growth from 100 to 120, 20 is a lot more than 2 from going from 10 to 12, or going, excuse me, from going from, I'm screwing it up, going from 20 to 22 is a 10% growth. Going from 100 to 110 is a 10% growth. Okay, but you get the point. So the logarithmic allows you to keep that percentage change constant, right? So on a percentage change basis, this is a monthly graph of United stock. Look at that. It is a straight line. On a percentage basis, and from an investor standpoint, that's what United is known for. United is known for being hugely consistent over and over and over again for over 12 years. United stock has marched up almost in a straight line. Okay, it has gone up 1,450% from 30 to 465 between the passage of Obamacare and now. Let's benchmark that against the other 500 largest companies in the stock market, the S&P 500. The S&P 500 only went up 342%. So United, the value of United blew the rest of the stock market out of the water. United blew the rest of the stock market out of the water. Let's look at HCA. You're like, oh, HCA was so much a smaller company, right? Oh, they're not doing as well. Wrong. HCA actually just went publicly traded. I mean, they've kind of gone back and forth. It's an old company, but they just relisted their stock right after the passage of the ACA. Interesting. If they went public after the ACA, they must have thought that the ACA was pretty good for them. So guess what happened? Their stock went from 18 to 252. Again, on a percentage basis, it went up almost as much as United, 1,300%, versus the S&P again of 342%. So HCA, hugely successful. HCA blew the S&P out of the water. Novo Nordisk went from $14 to $142. It was up 914% over those 12 plus years versus the S&P 500 of just over, 300%. Novo Nordisk blew the S&P 500 out of the water. It blew the rest of the stock market out of the water. So here's the punchline. The CEOs and these healthcare companies are executing against maximization of the stock price. And the maximization of the stock price is misaligned with what is best for the patient. The financial misalignment in America with America's healthcare companies is a public health threat. Financial misalignment in healthcare is a public health threat. It's like unclean drinking water. It's like lead paint, okay? It is a public health threat. It's like asbestos, right? What is the specific nature of this financial misalignment? One, lack of competition, which allows for price increases, which decreases access. By definition, when the price goes up, the access goes down. Pharmaceutical companies, hospitals, PBMs all act to increase prices because of a lack of competition. And they're able to get away with it because of a lack of competition. Two, care restriction to increase earnings. prior authorizations and denials by insurance carriers retain more of their own money and increase their earnings, especially for Medicare Advantage plans. So for their Medicare Advantage plans, they're getting all this money from the government, and to the extent that they don't have to pay out that money to doctors and hospitals and other folks, then they can keep that and boost their earnings. And the earnings for Medicare Advantage members is more than double the earnings for a commercial insurance. On a per member basis, health insurance companies make twice as much on a Medicare Advantage patient than they do on a commercial insurance patient. So it's a huge cash cow for them through care restriction. Next up, overtreatment is another financial misalignment to increase sales. Because if you can do more, if you are a doctor, if you're a hospital, if you're a pharmaceutical company, if you can treat more, then you're increasing sales. Okay, the more you do, the more errors you get. Healthcare is hugely error prone. One of the best ways to reduce medical errors is to just not do the healthcare that didn't need to be done in the first place. I'll give you a specific example. There was a woman who got a stress test before a minor thyroid surgery. She should have never gotten that stress test. It was totally unnecessary. The stress test was a little abnormal. So they're like, we got to give her a cardiac cath. When they gave her a cardiac cath, they nicked some of the cholesterol that was in her ascending aorta, and it showered cholesterol emboli to her brain and to her kidneys and to her fingers and her toes. And she had a stroke and she went into kidney failure and she had gangrene of her fingers and her toes. All that could, and they didn't have to do the cath and they didn't have to do the stress test. And all of that could have been avoided had they just not done that in the first place and just put her on a beta blocker prior to her minor thyroid surgery. Okay. So medical errors from overtreatment is a huge problem, but it is financially incentivized. Overtreatment is financially incentivized to doctors, hospitals, and pharmaceutical companies. Now, on the flip side, there's also undertreatment because of financial misalignment. Because if the docs and the hospitals and the health insurance companies, if they can't make money off of it, they're not going to do it. If they're not going to make profit off of it, if they're not going to make a lot of revenue off of it, they're not going to do it. Perfect case in point on that. Inpatient psychiatric care. People with schizophrenia, like, they typically don't have health insurance. They typically don't have a job. They typically don't have any friends. They've oftentimes been ostracized by their families. A lot of times they're homeless. Like, there's no money in taking care of a lot of times people, and they're having psychosis. So they're having delusions and hallucinations. They think that, like, the sidewalk is talking to them and they need help. And listen, there are medications for schizophrenia that are hugely helpful that need to be given to them in an inpatient setting to kind of get them on the right path. And hospital after hospital after hospital are closing their inpatient psychiatric wards. There's no money in it. So if there's no money in it, they're not doing it. And so then people have to wait in the ER for weeks waiting for a psych bed because these hospitals have closed their psych beds. Fee-for-service primary care. If you're a fee-for-service primary care doc for traditional Medicare, it's almost impossible to make a living because the reimbursement is so low. So people don't go into it. They don't, ask a person on Medicare if they can get a primary care appointment. It's super hard because they can get a urology appointment. They can get a cardiology appointment because they do all these procedures. They can make a lot more money. But getting a primary care appointment for a Medicare person on traditional Medicare, super hard to do. Okay. So as we bring this to a close, my take-home points are many healthcare decisions are driven by the stock market, not what is best for the patient. Listen, when you're baffled by anything, just follow the money. When you're baffled in healthcare, just follow the money, and it will all completely make sense. So what are possible solutions? We are not here just to cause problems. We're here to bring solutions here on A Healthcare Z. All right. Believe it or not, Stephen Brill, in his excellent book, America's Pill, I highly encourage you to read it. I made an A Healthcare Z video summarizing it if you just want to watch that. He said, look, at the end of the day, we got to do price controls for pharmaceutical companies and medical device companies. We got to treat them like a public utility. So 1, do that. 2, the provider of care and the bearer of risk are one in the same. In other words, all the hospitals need to actually need to be risk bearing and have their own health insurance plans, just like Intermountain does, just like Geisinger does, just like Ochsner does. Okay, so this is not some sort of like crazy idea. It has been highly successfully executed by Intermountain and Geisinger and Ochsner as well. And it actually much better aligns the financial incentives so that the patient comes first as opposed to over treatment. So we are running late on time. So with that, I will briefly go to some of your questions. If I don't answer them, I will answer them in writing if I don't get to this here. Also, paying for expensive drugs or surgeries for cancer, but not home health aides for dementia. Yes, that is a misallocation of resources, Elizabeth. Thank you for that comment. And this is from a nurse who says, as an RN working in utilization management and case management, I agree that undertreatment is our biggest public health concern. The HP networks don't have real networks with true access. So undertreatment, so it's not that we just need to do less universally. We need to do less of certain things and we need to do more of other things. Okay, so it's a mixture, but it's a mixture that can be accomplished with the right financial incentives. Okay. And so with that, I want to thank you all for being here today. If you would like to connect with me on LinkedIn, please do so. If you would like to join my healthcare finance video email list along with 3,400 others, please email me at ericb@ahealthcarez.com. I will be happy to add you. If you would like a copy of these slides for today, please email me at ericb@ahealthcarez.com. I will be happy to send these to you. If you would like to subscribe to my YouTube channel, just go on to YouTube and type in A Healthcare Z, and I got like 12,000 subscribers on my YouTube channel. You folks are my colleagues in public health to improve the misalignment in healthcare, and I appreciate the effort of every single one of you, and I hope you have a fantastic weekend. Bye now.